Hi there, my name's Angie Weatherwax, and I'm a physician assistant at Integrated Pain Solutions in Dublin. Today I'm joined by Marilyn, a patient well known to our practice for about probably almost 15 years, right?
20 years.
20 years, long time. So we just wanted to kind of put a little spotlight on you today, Marilyn, because you have been through so much with your chronic pain syndrome, and you've channeled that pain into something very artistic. So Marilyn first started bringing us artwork probably about a year ago. Since then, our practice has really grown to love her artwork, and she chooses to channel her pain through her artwork and expresses herself that way. Marilyn, can you share with us about that journey?
When I retired, my husband's gone, two of my sons are gone. Living alone, you got to figure out something to keep yourself occupied, and you get tired of watching TV all the time. I started painting, and I'm not no famous artist or anything, but I just enjoy doing it.
You're famous in our office, of course. But what does the painting allow? It's obviously painting's not a medication. It's not a treatment. What does this hobby do for you?
It keeps your mind occupied. You never know unless you try it, whether you can do it or not. But I've always been a crafter, and, I've always liked art.
And what do you think the painting does for your mental health?
It just makes me feel like, God planted that seed in my mind to do this. And if I can make somebody else happy by giving them a painting, then, it doesn't cost me anything, really, just a small amount. And I like making people happy if that's what they enjoy.
And when you bring joy, how does that affect your pain?
It makes me feel like I'm not worthless. I mean, everybody wants to feel needed or wanted, or if that's how people look at me and they remember me because of the paintings, then
so that's a good feeling, right?
Yeah.
Yeah. We remember you for a lot more than just your paintings. But it's a nice token and souvenir. Can you share with our audience a few other things that our office has done to help you through the pain journey?
Well, the injections that I get, I have bursitis real bad, and then I'm getting the shots for my arthritis in my back, and I have the spinal cord stimulator implant.
And you use that kind of as needed now?
Yeah.
Okay. Because I know when Marilyn worked long hours back when she worked standing on concrete, so the spinal cord stimulator was life-saving for her at the time.
I was a cake decorator, yeah.
Yeah. And I also want to share, it was very humbling for me when we had that visit, when you expressed to me, like, I have this mid-back pain. It's right in the middle of my back. It's, achy in the morning. It hurts when I extend back. I think I need injections. So you actually brought, she said, I think I need an x-ray of my mid-back. I said, well, let's go ahead and do that. And sure enough, we saw the spondylosis, or the arthritis in your back, and we recently have completed medial branch blocks. And can you tell them how that's helped you?
Well, the pain's gone, and I can sleep now without waking up in the middle of the night. Yeah.
So we're moving forward to doing some radiofrequency ablations for some lasting benefits. So, yeah.
Gladly.
Yeah. If you could give advice to fellow, your peers that deal with chronic pain, what advice could you give them?
Well, take your medicine the way it's told you, you're told to take it. You have to put yourself on a schedule and stay on that schedule. Mm-hmm. And then you have to be able to talk to your doctors and not be afraid to tell them when something's wrong, because they don't know what your body's going through, and they don't know what you're feeling, so you have to be able to speak to them. And I feel like I can speak to you guys because I've been coming here for so long. Y'all know me.
Yeah. And that's the same reason that when we have a relationship like this, when you can make suggestions and we listen, and it's humbling as a provider. I've been a PA for 20 years, and it's great for me to step back and say, you know what, Marilyn, you're right. Let's try that. And that makes us both successful.
I just want to have the best life that I can have without being in pain all the time, and nobody wants to be in pain,
I agree.
And I've been coming here for so long. When I thought I was going to have to change doctors, I thought, no, because I'm used to everybody here, and everybody knows me.
It's our big Dublin family, right? All right. Well, thank you so much for joining us today, Marilyn. It's been a pleasure to work together. It's a good partnership here, and I hope that your inspiration can inspire others.
I hope so too. Maybe you'll get more paintings.
Hey, you never know. We'd love them.
Okay.